Hi everyone, so we're here at Pro Action Sports Injury Clinic with Dr. Shane Baylis, who is also known as Doc Hockey. So I have some questions for you. So why do people call you Doc Hockey?
Well, that's a very good question. I often get this question asked to me, obviously because of the name and because my license plate on my car says Doc Hockey as well. So basically, I've always loved to play hockey since I was a young kid. So I used to go in the ponds and stay there for hours. And just growing up loving hockey, I watch hockey and follow it pretty closely. I also work for Endeavor Sports Group, so I'm an instructor. I'm teaching kids all the time, from skating to stick handling to shooting, and all different tactics that we do with them. We also do player mentoring and coach mentoring. So basically that means we go to the different hockey games, we'll watch how the players play, if we can give them any insights on how to play a little bit better or some things that they're doing well and things that they aren't doing well, as well as with coaches as well, strategies on coaching, practices, and how to relate to their players a little bit better. So we always get to do that. And above all, I get to treat athletes and players all the time, so that's really a great thing in my life that I enjoy quite a bit because I can relate to these players knowing about the injuries that they've had during the year, as well as kind of struggles that they go through playing in a competitive league. So it's a great thing, and we get to work with a lot of the local junior A teams, the junior B teams, and even AAA and so on and so forth. So that's kind of where they get the name Doc Hockey from.
So what made you start playing hockey in the first place?
Well, I was actually growing up in St. Catharines, so it's in the Niagara region, and I was playing when I was 6 years old, and I was with a terrible team, and we lost every game, and our coach yelled at us, and so I ended up quitting hockey my first year, and my dad asked me to go back the next year, and we actually won the championship, so that probably turned everything around, so I continued to play hockey until later on, where I played AAA hockey in St. Catharines, then played junior hockey in Brantford and then Port Colborne, and then I was actually drafted by the 67s in 2000, but I actually went and played for Niagara University for 4 years in Division I, playing in the NCAA tournament one of the years against Ben Eves and some other notables that are playing in the NHL now. And that was a great experience for me. After I finished with Niagara University, I actually had some tryouts with the AHL and the Syracuse Crunch, and I decided to follow a career in chiropractic and sports therapies.
So besides that, what made you decide to become a chiropractor?
Well, I've always liked the natural way of healing and performing, so increasing yourself by your own abilities of your body to heal itself. So I went in doing those types of things, went along with my thinking process. So I did a lot of visualization with my father. He was a counselor, and we always, visualize your goals and scoring goals and how you would do it. And that kind of energy and doing that as well was a natural thing to increase performance. So I kind of wanted to go along those lines as well. And then I met a few people that told me to do active release technique and some of the soft tissue therapies, which really helped me out with relating to sports therapies and athletes to get them better and perform better.
So what do you expect patients to experience at your clinic?
Well, when patients come in, I like them to experience that we do more than just one thing, right? We don't just do adjustments, and we don't just do exercises. We do a whole bunch of things. We have active release technique, we have Graston, we have medical acupuncture, we have kinesiotape, we do shockwave. We have a great concussion and treatment protocols as well as management, which is one of the things I'm really proud of because we keep getting better. We go to shift concussion seminars and R2P seminars, which are a lot of concussion related information that we just keep learning more and helping our patients even more get back to what they love to do, if it's from just the workplace or from getting back to their sport and playing with their kids. It's really an uplifting kind of thing. So we don't just have one tool to help with people. We have a whole bunch, and we don't just use all of them for just one patient every time. We use the one that fits their diagnosis. So if they have a certain problem like a tendinosis, we may use shockwave, which is really good for tendons. And if it's more of a muscle kind of therapy or separating muscles, we use a lot more active release technique. So those techniques have to fit the problem. That's the big thing, and we want the patients to know that they have value when they leave. So a better range of motion, less pain, increased strength, more fluidity with their movements. They're all very important. And so when they leave, they may not be fully better right away, but you can see the progression that's going on with the different testing that we do. So it's really a great thing for them to see and be able to relate that they are getting better. So that's one thing we try to get them to know, is that we have value when they leave and that they are getting better.
So thank you for your time, Dr. Baylis. It was nice talking to you, and I hope to talk to you again soon.
Thank you.